Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern Steinberg School of Medicine, who answers your COVID questions every Wednesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer submitted questions and addressing the latest COVID headlines through today, March 24th. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today is myself, Sophie Bukowski, Student Research Assistant with the Institute. So, Dr. Murphy, I'm going to start with some updated COVID statistics.
Thank you, Sophie.
In the United States yesterday, there were 45,145 new cases, with a 7-day average at about 19,500 cases, with a 34% decrease over the last 7 days. Hospitalizations have decreased by 14%, and the deaths are also decreasing by 36%. In Illinois, the last reported cases were yesterday, with 8,438 new cases for the week, basically. Cases are decreasing by 20%, hospitalizations are decreasing by 12%, and the death rate is also decreasing by 15%. So, okay, what can you tell us about all of these decreases? Because 45,000 cases per day has been the consistency for so long. So what does this mean?
Well, I mean, COVID is endemic now. We've passed the pandemic stage and now it's endemic. And for the first time in a long time, deaths are less than 400 per day. Keep in mind, our reference is flu. The average is 100 per day. But flu is only 6 months a year. So it's 200 a day for 6 months, then it's zero, but basically, So all that is expected. Because the numbers have gone down. And the numbers have gone down because of two things. One is vaccinations and people getting boosted and double boosted and whatever, and also the immunity that you get from having COVID. I mean, essentially everybody's had COVID. Almost everybody has had COVID. So you get immunity, but you get immunity. The best immunity you get is if you had COVID and the vaccines and the booster of the vaccine. So there's enough people in the population in the world now that these numbers are going down globally. And now there's, the world is a big place. So some places popping up a little bit, whatever. But here in the United States, we're seeing this big drop off. We didn't have a big like Omicron spike like we did last year. This year was much more subdued. And we're just entering another phase of the disease. So that doesn't mean you don't get it, but it's down in the where it is here with a death rate per day of less than 400, which apparently as a population we've just accepted that. So we'll see how low that goes. We don't really know. The models are vary so much, so we don't know, but it's going to hit some kind of level and plateau off, and we'll see where that is, but we don't know right now.
Well, wonderful. Well, all right, going into our first COVID headline, Dr. Murphy, can you talk to us about pregnancy and COVID, and what should women know who are pregnant, who want to get pregnant, who test positive while they're pregnant, etc.?
Right. No, yeah, I mean, this is a big thing. So, as the pandemic is now 3 years old, we know a lot about what happens with pregnant women. And pregnant women are particularly vulnerable to COVID. And that maternal mortality, that's death while you're pregnant, rose significantly starting in 2021. And this is due to COVID. So COVID is not good for pregnant women. The vaccines are effective. Women can take it. There's been no problems with the vaccine and pregnancy. And, if you're pregnant, you just have to be a little more careful, mask in public spaces, limit your contacts, practice social distancing and stuff while you're pregnant, because you are a little bit more susceptible than the general population and your risks are higher. So, and not only the women, but, some of the babies, they tend to be more premature births and more serious problems. And there does appear to be slightly higher risk of congenital heart defects in women, in babies born to women who had COVID. So, and this was done by the research firm Epic, which controls a lot of the medical records in the United States, and they looked at all the records and they found that. Now, if you do happen to get COVID while you're pregnant, you can take Paxlovid. That's the Pfizer drug. It's taken twice a day. It's safe during pregnancy and can limit the risk to the woman and to the baby.
Wonderful. Well, going into our second question, our second headline, I apologize. The Moderna CEO Stefan Bancel defends the five-fold prices hike of the COVID vaccine during the Senate grilling. So, what can you tell us about what is going on with this rise in prices for the Moderna vaccine?
Well, this is really indefensible. To take a vaccine where they made billions of dollars selling it at $26 a shot, and now they're raising the price fivefold because the government is no longer, they had one customer before, the government just bought everything. Okay, that's nice, but I mean, this is just indefensible. This is just gross, and this is why people are so angry at the big pharmaceutical companies. I mean, these companies have made, just billions of dollars, and they got a lot of help from the U.S. government in the development and in the pre-purchases, let alone the purchases, and it's just gross, frankly. So, I don't know what can happen because it could, it's got to be something congressional or something like that. Some law has to be passed or whatever, or they could just be shamed. The same thing happened kind of with Eli Lilly and insulin, and they backed off on that. So, it really depends, but I mean, this is just, it's just very unfortunate because the higher you make it, somebody's going to pay somewhere. The insurance companies are going to have to pay, or you're going to have to pay out of pocket, and people are not going to take it if they pay out of pocket. They don't have that kind of money, most people. Well-off people and insured people are going to do fine. People on Medicaid are going to do fine. We have so many different kind of health plans. A lot of people aren't going to notice even the difference, but there's going to be money coming out of somewhere, someplace. It's just really unfortunate because the working poor are not going to, they don't have the right kind of insurance, or, they have to pay out of pocket. They won't do it. I mean, this is not the way you handle an endemic, let alone a pandemic. So the pandemic part is over, but I mean, this is just gross.
Right. All right, Dr. Murphy, I wanted to ask you our one and only question. So we're going to move into our COVID reviewer submitted questions. Talk to us about what is going on with all of the news that there is now this raccoon dog, I think is what they're calling it, that has now started the COVID pandemic. What can you tell us about all of this?
Well, we've been talking about the lab leak theory since the beginning of COVID. There's this virology institute in Wuhan, the Wuhan Institute of Virology. And, it was suspected early on, maybe it was coming from that, even though they weren't working with COVID, all right? But they have the technologies, they could work with COVID, and ultimately they did after the pandemic hit. And there was always a question whether was this really from the laboratory, and the Chinese are very opaque and trying to control all the discussion, but 2 WHO groups of scientists have gone there, investigated, talked to everybody. No whistleblowers have ever come forward, and everything 99% chance that it jumped from an animal to man, just like SARS did, just like MERS did, just like HIV did, and other tropical viruses. So, and then, so what, then of course, when the pandemic started, the first suspect was the Wuhan market, and the government slaughtered all the animals there and destroyed them. As a public health measure. Apparently they didn't save any samples from them. However, in the samples that they did take from the market itself, they found the virus, of course, COVID, but they've also found some DNA from this animal called a raccoon dog. It's related more to a dog than a raccoon, by the way. So, and they were selling them there. They were known to be in the market. There's pictures of them being sold from years ago, and they were around there. And we know that they can, they have can get COVID. So it's just another piece of evidence in this whole saga. And it's 99% chance it jumped from an animal, just like all the other ones. But scientists, unless they have, really 100% proof, they'll never say 100%, but it's 99%. So, you put your money where the numbers are. The only problem, I think, with looking at the lab, suspecting the lab, is that it's an unanswerable question. The Chinese are not going to really give us any more information. They may not even have any more information. Who knows? We'll never know. But it's not an answerable thing. So it has gotten, it's a political football. And this is the only new information that has come out lately. And you have two agencies within the government, the Department of Energy and the FBI, who think that it's most likely, or actually with low confidence from the Department of Energy and with moderate confidence from the FBI. These are not agencies that actually study viruses. So the Department of Health and Human Services, which includes the CDC and the NIH, they say, with very low confidence it came from the laboratory. So, if you go with the scientists, the international ones that have been there, the ones in our own country, it looks like it comes from animals. The problem from a public health perspective, if people just keep badgering this lab leak phenomenon, is that it takes away from the crisis that we have in animal transmission of viruses. And like, what's the next pandemic? I mean, it's not going to come out of the Wuhan lab. It's likely to come from some other animal source. So we've really got to beef up our preventative and protective measures that we can take to stop the next pandemic. And it's not looking at some laboratory. It's looking at the animals that carry these viruses. Now, that's not to say that we want to have a bunch of laboratories that don't have appropriate safety precautions. That's another whole story altogether. That is another whole issue, and that is a real issue. And that should be done. It's going to be hard because you're talking about international agencies and whatsoever. We do it with nuclear power. There are international agencies for that have some kind of handle on everything. And so it's something like that really needs to come forward. So it's not like we don't want to ignore the laboratories, but the next pandemic is coming from the animal kingdom, I'm afraid.
Wow, this is all crazy. Well, thank you so much, Dr. Murphy, and we will see you next week.
Yeah, great. All right, Sophie, congratulations. Thank you for helping us so much, and good luck with your career. This is Sophie's last day.
It is. Thank you, Dr. Murphy.
Right.
I appreciate it.
Thank you so much for joining us all these many weeks and months, and it's been working with you.
No, thank you, Dr. Murphy. It's been a pleasure.